After 60, one of the most dangerous health problems is not always the disease you know you have. Sometimes it's the silent biological chain reaction happening underneath it. And tonight, I'm Dr. Richard Vance, need to talk to every senior taking vitamin B12, especially if you also take medication for diabetes or acid reflux. Because what many people do not realize is that the real danger may not be the B12 supplement itself. The danger may be believing your body is actually absorbing and using it properly. Right now, millions of older adults are swallowing B12 every morning, thinking they are protecting their brain, nerves, memory, and heart, while two extremely common medications may quietly interfere with the very system required to process that vitamin correctly. And the symptoms usually do not begin dramatically. It starts subtly. A little more fatigue walking upstairs, a little more numbness in the feet, brain fog, poor balance, forgetting names, feeling drained even after sleeping. Most people blame aging. But here's what concerns many cardiologists and metabolic specialists after age 60. When vitamin B12 absorption begins breaking down silently inside the body, it can affect far more than energy levels. It may influence nerve health, blood vessel function, oxygen delivery, and something called homocysteine, a compound strongly associated with cardiovascular risk when it remains elevated over time. And the two medications most commonly connected to this problem are medications millions of seniors take every single day. Tonight, I'm going to explain the two medications you need to know about, why this problem becomes more serious after 60, the warning signs most people ignore, and what you can safely do to protect yourself without stopping important medications your doctor prescribed. Before we begin, tell me your age and where you're watching from in the comments below. And if you care about healthy aging, heart health, memory, and mobility after 60, make sure you subscribe, because these are the kinds of conversations many seniors wish they had years earlier. Now let's talk about why vitamin B12 becomes so important as we age. Most people think of B12 as an energy vitamin, but that barely scratches the surface. Vitamin B12 is deeply involved in some of the most critical systems in the human body. It helps produce healthy red blood cells, the cells responsible for carrying oxygen throughout your body. It supports DNA repair. It helps maintain the protective coating around nerves called the myelin sheath. Think of myelin like the insulation wrapped around electrical wires. When that insulation weakens, nerve signals begin misfiring. That can lead to tingling, numbness, burning feet, poor coordination, weakness, and even memory problems. And this is where the story becomes more important after 60, because aging itself already changes the digestive system. Many older adults naturally produce less stomach acid with age. The stomach lining becomes less efficient. Nutrient absorption slows down. Appetite changes. Medication use increases. So even before medications enter the picture, the body may already be struggling to absorb B12 properly. But what happens next matters most, because two of the most commonly prescribed medications in older adults may quietly intensify this problem even further. The first is metformin. If you have type 2 diabetes, there's a very good chance you've heard of it, or you may be taking it right now. And to be clear, metformin can be a very effective and important medication for blood sugar control. For many people, it is absolutely necessary. This is not about fear. This is about awareness. As a cardiologist, one thing I, Dr. Richard Vance, worry about is when patients think they are protected nutritionally, while silent deficiencies continue developing underneath the surface. What many patients are never clearly told is that long-term metformin use has been associated with reduced vitamin B12 absorption over time, and the mechanism is fascinating. Normally, B12 absorption is a carefully coordinated process. First, stomach acid helps release B12 from food proteins. Then, a special transport protein called intrinsic factor binds to the B12 molecule. That combination travels into the small intestine, where the vitamin is finally absorbed into the bloodstream. It is an incredibly delicate delivery system. But metformin appears to interfere with part of this absorption pathway, especially in the lower small intestine, where B12 uptake occurs. In simple terms, the vitamin may enter the digestive tract, but not fully reach the cells that actually need it. And here's the dangerous part. The symptoms often develop slowly enough that people assume they are simply getting older. Let me tell you about Harold. Harold was 72 years old and had been taking metformin for nearly a decade. He considered himself relatively healthy. He walked every morning, watched his sugar intake, took his medications exactly as prescribed, and added a B12 supplement because he had heard it was good for seniors. But over time, he noticed something strange. His feet felt colder. Then came occasional tingling, then fatigue that sleep never fully fixed. Eventually, he started losing confidence walking downstairs because his balance felt slightly off. He blamed age. His family blamed diabetes. But when deeper blood testing was finally performed, his active B12 levels were low despite taking supplements regularly. And this is where many people become confused. Because standard B12 blood tests can sometimes appear normal, even when the vitamin is not being effectively utilized at the cellular level. That's why many physicians also look at markers like methylmalonic acid and homocysteine when deficiency is suspected. Now let's talk about homocysteine, because this may be one of the most overlooked cardiovascular risk signals in older adults. Homocysteine is a naturally occurring amino acid in the body. Under healthy conditions, vitamins like B12, folate, and B6 help convert it into other useful substances. But when B12 status becomes impaired, whether from poor absorption, aging digestion, or medication interference, homocysteine may begin building up. And elevated homocysteine has been associated with inflammation and dysfunction in the inner lining of blood vessels. Think of the inner lining of your arteries like smooth glass. Healthy arteries are flexible, responsive, elastic. But chronic inflammation can gradually make those vessel walls more irritated and less resilient over time. That matters after 60 because aging arteries are already under more stress from blood pressure, cholesterol exposure, blood sugar changes, and oxidative stress. And this is why cardiologists pay attention to this pathway. Not because B12 is dangerous, but because poor B12 metabolism may quietly contribute to larger cardiovascular problems when ignored for years. And the second medication connected to this issue may surprise even more people. These are proton pump inhibitors, also called PPIs. Medications like omeprazole, pantoprazole, and esomeprazole. Millions of seniors take them for acid reflux, GERD, stomach irritation, or ulcer protection. And again, these medications absolutely have legitimate medical uses. But here's what most people are never told. Stomach acid is not just there to cause heartburn. It also plays a critical role in nutrient extraction. When you eat meat, eggs, dairy, or fish, the vitamin B12 inside those foods is tightly attached to proteins. Your stomach acid helps break those proteins apart, so the B12 can be released and absorbed. Without adequate stomach acid, that release process becomes much less efficient. So when acid-blocking medications are used for long periods, especially in older adults already producing less stomach acid naturally, B12 absorption may decline gradually over time. And because the process is slow, people rarely connect the dots. The body whispers before it screams. It whispers through fatigue, through brain fog, through burning feet at night, through poor concentration, through weakness climbing stairs, through feeling physically older than you should. And here's what most people never get told. Some symptoms of B12 deficiency look almost identical to normal aging. That's why so many cases go unnoticed. A person says, "I'm slowing down. I'm just tired. My memory isn't what it used to be. My legs feel weaker." But underneath those symptoms, the nervous system may be struggling with inadequate nutrient support, and severe long-term deficiency can sometimes contribute to nerve damage that becomes difficult to fully reverse later. That's why catching the problem early matters. Now, I want to make something very clear because this is important. The answer is not to panic and stop your medications. Metformin and acid blockers can be medically necessary and very helpful for many people. The goal is smarter monitoring, smarter supplementation, and better conversations with your doctor. So what should seniors actually do? First, if you've been taking metformin or a proton pump inhibitor long-term, talk with your physician about checking your B12 status. And, in some cases, ask whether additional markers like methylmalonic acid or homocysteine make sense for you based on your symptoms and medical history. Second, understand that the form of B12 may matter. Many standard supplements use cyanocobalamin, which the body must convert into active forms before use. Some clinicians prefer methylcobalamin for older adults because it is already in an active form the nervous system can utilize more directly. Third, avoid assuming that more is always better. Many seniors take extremely high-dose supplements thinking it guarantees protection. But healthy biology is about balance and utilization, not just flooding the bloodstream with nutrients the body may struggle to process properly. And this is where things become especially important after 60, because aging changes the entire metabolic environment. Kidney function may decline slightly, digestion changes, medication burden increases, inflammation rises. The body becomes less forgiving of imbalances that might have gone unnoticed at 40. Fourth, focus on food whenever possible. Excellent B12 sources include salmon, sardines, eggs, yogurt, beef, shellfish, and fortified foods. But for some people with significant absorption issues, food alone may not fully correct deficiency. That's why some patients require sublingual supplements or even injections under medical supervision. And there's one more thing I want every senior watching tonight to remember. Sometimes the body is not failing nearly as fast as you think. Sometimes the body is signaling, quietly, repeatedly, asking for support, asking for attention, asking for investigation before symptoms become severe. I recently spoke with a woman named Beverly who had been on acid reflux medication for years. She thought exhaustion was simply part of getting older. She stopped gardening because her legs felt weak. She became less social because her energy disappeared by afternoon. And when her physician finally investigated deeper nutritional markers, the issue became much clearer. Several months after correcting her deficiency and adjusting her supplementation approach under supervision, she told me something powerful. She said, "I didn't realize how poorly I felt until I started feeling stronger again." That sentence stays with me, because many seniors slowly adapt to symptoms that should never be ignored. Fatigue becomes normal. Brain fog becomes normal. Weakness becomes normal. But normal aging and silent deficiency are not always the same thing. So here's your action plan starting tonight. If you take metformin or acid-blocking medications, review your supplement routine. Discuss B12 testing with your doctor. Pay attention to symptoms. Prioritize nutrition. And never assume that a normal standard lab automatically tells the whole story. Especially after 60. Because protecting your brain, nerves, circulation, and energy is not about chasing miracle supplements. It's about understanding how the body actually works. And once you understand the mechanism, you make better decisions for the rest of your life. I'm Dr. Richard Vance, and if this video helped you, comment below and tell me whether you take metformin, acid reflux medication, or B12 supplements. I read those comments carefully. And please share this video with a parent, spouse, sibling, or friend over 60, because someone you love may be dismissing symptoms that deserve attention. Subscribe for more evidence-based senior health education. And as always, take care of your heart, protect your brain, and I'll see you in the next video.